Welcome to the DoubleACS Daily News. The City of Attleboro was paid about $368,000 last year in opioid settlement funds, and now city leaders are looking for public input from residents on how to use the money. We spoke with Mayor Kathleen DeSimone and City Health Nurse Allison Brum to learn more.
My name is Kathleen DeSimone. I am the mayor of Attleboro, and I am happy to talk to everybody about the opioid settlement funds that the city is receiving from the Commonwealth as the result of nationwide class action lawsuits against drug manufacturers, distributors, pharmacies, all of those folks involved in the distribution of opioids, which helped very much to create the epidemic that we have had and continue to have, and all the ramifications thereof, folks struggling with addiction. A lot of opioids are still being prescribed, and I'm not a doctor, and I cannot state when they shouldn't be used, but it seems like they're still very much being prescribed despite the likelihood of addiction. Certainly, there are people who may be predisposed to addiction for various reasons, whether it's mental health or trauma or stress. Rich, poor, black, white, all different folks are impacted by the opioid crisis, which is, I think, one thing that people need to understand. It's not one particular group's problem, it's everyone's problem, because to some degree, we're either all impacted by it or somehow paying for it. I'm particularly grateful to the Commonwealth and Governor Healy in her capacity as the Attorney General for pursuing the lawsuit, and I'm very much looking forward to Attleboro's share of the funds to do whatever we can to help folks who struggle and the people who love them.
My name is Allison Brum. I'm the public health nurse for the City of Attleboro, and I've been a nurse in the emergency department as well as having a passion for public health. And here at the health department, I do offer a wide range of services to Attleboro residents, from infectious diseases and immunizations to community outreach and prevention. We're really pleased to introduce the Attleboro Opioid Settlement Survey, and the purpose of the survey is to really determine what programs, policies, and practices that the public wants supported through this settlement. The survey is really designed to determine the public's feedback and input in regards to some key areas, such as prevention, harm reduction, and really how we can best utilize the settlement to easily navigate resources. So the results are actually showing us that persons are reporting difficulty in navigating local community resources, and also there's reported difficulty in securing transportation to treatment and recovery. When we consider substance use, we really have to recognize the impact of trauma and adverse childhood experiences and how that can impact someone later on in life. And so what we also want to focus on is early identification of mental health disorders and how we can better help future generations navigate this. As we transition from the COVID-19 pandemic, we do have to consider the impact it had on mental health, and we also have to consider the impact of social media and a constant news feed and how that affects our mental health. So we have to look at the relation between that and substance use disorder. At the health department, we did create a good starting point. We added a substance use disorder page to the city's website, and it's a one-stop resource. It's a page that you can identify local community treatment centers, counseling, and also you can find a support group through the webpage. And the support groups are a really important part of recovery and peer support in particular. The survey is available online. You can find it at the City of Attleboro's Facebook page. We also have hard copies available at the Council of Aging, the Attleboro Public Library, and in the main lobby of City Hall. And the survey will be open through August 7th, so we really value the input and feedback of all community members. So we've already had a great response to the survey. In review of the results, we're seeing on the topic of prevention, most respondents are finding there is lack of early identification of mental health disorders, and there's also lack of awareness of the impact of trauma and adverse childhood experiences in relation to substance use. We're also noticing that most respondents report difficulty navigating local community resources and also difficulty securing transportation to treatment and recovery services.